Welcome to today's Global Connections program. I'm Bill Miller. Today we're going to take a look at the healthcare system, or health delivery, shall we say, in the United States and in other countries around the world, and to share some ideas that are really innovative and transformative as to how we could have a more efficient and more effective system. My guest today is someone who's got some very creative ideas. Dr. Frank Maletz, a medical doctor and founder of HEALTHspital Family Foundation, is my guest. Frank, welcome to today's Global Connections program.
Well, thanks for welcoming me.
My pleasure. I mentioned HEALTHspital, H-E-A-L-T-H instead of hospital, H-O-S. What is the difference, just generally a generic difference between a hospital and HEALTHspital?
Well, I certainly think everyone on the call will understand what a hospital is. Most of us have been to the buildings where sickness care is delivered, surgeries are performed, lab tests are done, and a lot of imaging goes on. And all of what we call the silos of care, the specialists are all available to handle most of our sickness needs. What the concept, and again, it's in my mind, is to take the hospital, not burn the buildings down, not dismantle them. We love the fact that they do their work so well, but add to that the concepts of health, that is health producing and health sustaining, and bring them under the umbrella of the care organization. So the hospital becomes a healthspital in order to incorporate health plus all of the things that the current hospital is able to produce.
Mm-hmm. Okay, that's very good. And now, if our viewers would like, they can go to your website for more information on this. A lot of it we'll be talking about today. They can go to www.healthspital.org and read a little more about it. You've got 8 pillars that sort of underline your basic concept. Let's go through those 8 pillars and talk about them and see how they're very creative and innovative in many respects, and could certainly help transform our healthcare delivery system in the United States. But what is your first pillar?
So the concept, again, the HEALTHspital is what we call a platform. It's a cognitive space for revisioning the hospital. So the platform has to stand on some foundational pillars, I call them. And so there are 8 of them that are intrinsic to the model, and without belittling any of them, they can't be excluded. So we need all 8. So it is an ecosystem in its development. So pillar number 1, I call the Hill of Rights. We get in the HEALTHspital, we get everything right. The right patient is matched to the right diagnosis, is matched to the right care, is matched to the right provider expertise, etc. So if everything in the intervention, and again, we're still in the sickness care model, is gotten right, then the answer is we are much more effective. And so in every interaction, in every relation, it is critical to mission to get everything as right as we can. The second pillar is often referred to as lean or lean healthcare. And that model certainly exists in isolation. What I mean by that is that in the sickness care intervention, in the evaluation process, all waste, fraud, abuse, and any excessive redundancy is basically eliminated. So again, the answer is to try and make the encounter seamless and without a lot of repetitive testing, et cetera.
That's a major issue, and I think that's true in every industry. But the two that come to mind when I think of waste, fraud, and abuse are, first off, the Defense Department. We're all in agreement. We all want a strong Defense Department, but we know the waste is just unbelievable in that operation. And I'm sure there is too in the healthcare industry. How do you get rid of that, especially when you have a situation, as I understand it, where so many of the items that are, for example, pharmaceutical industries, they charge basically what they think the market will bear, and some of the charges are outlandish. You've got medical supply or dealerships who raise their prices 100, 300, 500. One guy told me 1,000% on stethoscopes. How do you get that out of there to bring those prices down? And I'm sure as a doctor, you've seen the prices jump all over the board. You could probably get an MRI in one place a lot cheaper in another place. Can you not?
So again, and again, I don't want to focus too much on the fraudulent aspect of things, but if the ecosystem centered around health were to become transparent to the extent that, and may even involve some future thinking blockchain parameters, the answer is the outliers would be exposed, and the patient using the services would have a much clearer idea of what things cost and the range of available options that may be equally effective, but cost less. And there can be some selection, therefore, among the consumers that would not be possible given the opacity that's built into the current non-system of sickness care. And don't forget, too, that when we're dealing with a sickness care non-system, that folks need the service urgently a lot of times. They're in the emergency room. They're not going to be conscious consumers and ask for pricing. They need help. And so the concept of having a health ecosystem allows them preliminarily to think through some of the problems and decrease the amount of urgency and emergency that's built into the current methodology.
Okay. No, you're right. You can't go price shopping when you're lying on the operating table. It does not work that way, right? Okay. And then the third item, what is that?
So pillar number 3 is again something that has been well talked about in isolation, but that's the what's called the chronic care methodology. And because of the successes in public health over the years, folks are living longer, things are wearing out, and our bodily systems need attention. And so we build up chronic problems. So it's not unusual for folks in their 70s, like me, to have a little bit of hypertension and a little bit of arthritis and a little bit of type 2 diabetes and a little bit of hypercholesterolemia and some decreasing functions. But what is very clear is that each of those items will have its own specialist, will have its own area of primary interest. And it is not unusual at all for your primary care internist to refer you to specialists in all those silos. They write prescriptions, and so before you notice, you've got 8 physicians or provider organizations that are prescribing upwards of 10 or 15 meds. And does anybody really know what all of those medications do when they interact in the system? And as you well know, most of the science that's behind any of the medications is usually done either one medication against no medication or one medication against another similar, and nobody tests 15 medications in the same human body. So the pillar 3, which is mission critical, is to have an integrator who has access to all your information be available at every point of care, so that we minimize the adverse effects from having too many cooks in the broth, if that makes sense.
I see. Now, there's one, I was looking at your pillars, one that really jumped out at me. They all did really, but one is Repre Pro COS. What is REPREPROCOS?
So pillar number 5, which it takes us from the first 4 pillars, which are all involved in the sickness care paradigm. And now the one I love the most is pillar number 5, because that's really the transition pillar to the HEALTHspital. So what I've called those is the REs, and anything with an RE gets to play. So things like regenerative medicine, restorative medicine, resilience, that's a RE. The pre's are very easy. Prevention, preemption, where we actually, before the disease causes us to go, as we said earlier, to the emergency room or to be on the operating table, we preactively get things, get the patient aware of things, and get them working on prevention. Promotion, obviously the pros include promotion, proactivity, those sorts of preliminary things that folks can do actively to get themselves better health. And the COs also very easy. Medicine, surgery, healthcare, ideally is a team sport. So we need to co-design, co-create, collaborate much more effectively in order to build health into our healthcare paradigm.
Mm-hmm. Now, would these suggestions up to this point, would they tie into something like a well-rounded or all-inclusive wellness program? How would that fit into this? It seems like you're dealing with the whole system and the whole person, and not just the particular ailment. It sounds like it's a broader situation. Is that correct?
Absolutely. So we're actually, and it's on the website too, but we're not looking at health care delivery in small letters. This is health with a capital H. We use the question whenever we're facing anything. The first question we always ask at the HEALTHspital Foundation is it healths? In other words, the starting question is what we're talking about, whether it's climate change or whether it's the local hospital, are we doing the maximum optimal amount of thinking that makes it as health fulfilling as possible?
That is extremely, extremely important to do that. Well, you're watching Global Connections Television, which is a privately funded, independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guest. We'd encourage our viewers to go to our website at www.globalconnectionstelevision.com to view previous programs. Also, if you're involved with any type of a PBS or community access television station, or perhaps an educational institution that has an intra-campus television hookup, or you have a podcast, or you just have a computer, you like our programs and you want to share them, please feel free to do so. Global Connections Television is provided at no cost as a public service to help us better understand international issues and how they impact our lives. Today, we're taking a look at some really innovative approaches to the healthcare system in the United States and possibly in other countries of the world. My guest has some really innovative ideas on this. Dr. Frank Maletz, a medical doctor, is the founder of HEALTHspital Family Foundation. Frank, we're talking about some very interesting ideas. I was curious, thinking about all the debate, we've had debates swirling around the healthcare system in this country, whether it's better to have private insurers. We hear a lot about Medicare for all. We hear about some of the other countries, like apparently France has one of the best healthcare systems in the world. Switzerland, as I understand it, has a very good one. Israel, some other countries like that. How did these discussions on overall healthcare plan, like with private funding versus single payer, tie into what you're talking about today?
So, Bill, that gets to the concept of paying for all of the things that we are required to pay for to keep a population in its optimal functional state, in its optimal capital H health. And to your point, there are absolutely systems that are touted to be better than the quote system in the United States. The focus, however, on a lot of these issues, and I'm very familiar with the British healthcare system, that it still revolves around interventions, sickness care, and how to pay for it. And those folks that pay for it better than we do are touted as being much better. I would still tell you that, having surveyed at the World Future Society a number of the world so-called systems, we're still not getting optimally at preventive care, at re-preventing after interventions for diseases have occurred. And I don't think anyone that I have seen it has built into their ecosystem what we like to call, once it forms up, a ecosystem, a healthy ecosystem where health is accepted to be a human right. And everyone deserves to have access to the best that we have at this moment. And realize also that there is much we don't know yet. There is much in the social determinants of health that we don't appreciate. There is a lot of research that still needs to be done to keep us optimally health fulfilled. But the key is, and again, this is a model, this HEALTHspital model is a way to get the best of the best on the world stage at every point of care for everyone. And that's not, as we like to say again, that is not a mainstream weem at this point. Health is, as you said so well, it is talked about. Folks are glib about alternatives and complementary options. But when we get down to actual fact-based, research-validated best practices, and were we to get them disseminated to every one of the 7.8 billion of us on the planet right now, oh my goodness, how much productivity, if we all felt our best and were as well as we could be, would we turn on to real health, capital H.
Exactly. Do you think, it sounds like we're talking also about a greater involvement on the part of the media, on part of governmental agencies, educational systems. For example, should our national government be more robust in developing programs to help people better understand how they can live healthy lives, why it's important to exercise, why it's important to maintain your weight to a certain degree, different things like that. The educational system, incorporating classes. I remember years ago, we used to have classes on healthy eating, nutritional values. I'm not sure they even have them today, to be quite honest. But do we need more? And I'm not talking about the nanny state or anything like that, or Big Brother, but just programs to help us better understand why it's in our best interest to live a healthy life and to have this 100% comprehensive wellness approach to developing that healthy life.
So that's a great segue to pillar number 7. We call pillar number 7 the participation pillar. Very often, in fact, far too often, left out of the discussion is the patient. The patient has some responsibilities too. That's why we don't like the term delivery. I think of delivery as getting a pizza delivered. I don't think you can deliver healthcare. I don't think you can deliver education. You have to have a fertile ground on which to plant those seeds. So the participation is a person who is interested in their well-being, is committed to it, and then where do they go right now in the current domain of healthcare? Where do they go for that best information? Well, we believe it should be the HEALTHspital. Those services can be charged for. That can be the new economic model for the hospital. But you are recently diagnosed with, let's say, type 2 diabetes, and your weight is out of control, and you've had a sedentary job for the last 15 years. Where do you go right now to get the best information, the most validated, scientific-based information? Well, lots of places. You can talk to your neighbor who might be an exercise fanatic. You could get on Google. You could chat with lots of different opportunities, go down to your local organic health food store and get some pamphlets. We think that the best place to go would be your local HEALTHspital. That's where all of your information relative to your health and diseases are collated on your electronic health platform. And that information through an entity like MyChart could be available to you, the participation. And then a customized program is co-created with your doctor's full awareness, your physician extender's full buy-in, and there could be appropriate telehealth communication follow-throughs to make sure that your questions are answered. When you're at the shopping store and you can't decide whether Brussels sprouts or broccoli is better for your diet for that particular purchase, you have a way to access that information at the point of care. The grocery store now becomes a point of care, not just the doctor's office. And that participation now gets information on the spot at the point of concern so that no mistakes are made. And back to pillar 1, they get their shopping right. They get information on how to cook that well so they're not mixing in the wrong stuff, like too much butter perhaps. And their diet and the weight loss can then be crafted onto their health record, so everybody knows that they've course corrected to the point where now they're on track to lose some weight, to get the diabetes under control, to get their A1C dead on, and all of a sudden the entire ecosystem is now interoperable. is communicating for the benefit of each person's capital H.
Well, these are some outstanding ideas, and I hope that a lot of folks pick up on them, and even maybe people in other countries too will take a look at these. And I can't believe we're out of time, but in the last 30 seconds, do you have one suggestion more that we didn't? I'm sure we have many more that we didn't get to today, but is there a closing comment you would like to make?
Well, as I have said, I've been at this since 2011 when this concept was born. And I am still anxious to get a proto-pilot so that we can take this from my head and my 6 boxes of data into a real test case, because this, in our world at least, at the Family Foundation, is a game changer. And we want everybody on the globe to be optimally health fulfilled.
That's for sure. Maybe we'll actually achieve living to 110 or 120 years old, but we should all strive for it. It's a very laudable goal, and it's in our best interest to do so. But anyways, great ideas, and I wish we had more time to get into some others. But Dr. Frank Maletz, I want to thank you so very much for a very interesting and a very informative program.
Thank you, Bill.
My pleasure. I am Bill Miller. Thank you for joining us today on Global Connections Television.